It's your girl, Carly Vet. Welcome to Elevate the Good, a podcast featuring organic conversations with good people living an elevated life and loving it, inspiring to elevate the good within you so you would live out loud with good vibes only. Be self-serving with goodness to unleash your greatness. Think the good, do the good, be the good. All things good. So let's get to it.
All right.
Dr.
Lorie Johnson is in his house.
Yes.
Finally, Elevate the Good. We've been talking about this for 2 years now, at least.
Mm-hmm.
You really actually were the impetus for me wanting to do something, but I just, life, got off. And then we started Elevate the Good on the other premise, but now we're circling back to Dr. Lorie. OB/GYN, MD, all of that. So I just did a quick little research off of your website.
Okay.
And I know you've been in practice for 8 years. You're board certified.
Actually, we got to update like 20.
20? That's why I was like, when it says over, but that's like, because I'm thinking like, I know it's like, see, 20. You can fix your website, right?
Got to update it.
But your pictures are cute on there, though. But so you are the real deal Holyfield, board certified American Board of Obstetrics and Gynecology. You're a fellow at the American College of Obstetricians and Gynecologists, American Academy of Anti-Aging Medicine. I mean, you are the real deal. So that's why I want people to know. I know this is more interview-like than most of the conversations I have. And so for background, the reason why I wanted you specifically, because a few years ago, actually probably like three, when I was going through my peri/menopause moment, and we were at a brunch for Tara's birthday, as a matter of fact. And I'm sitting there having hot flashes and going through the thing, and that's when you were like, oh, well, by the way, this is what I do. I'm a doctor. And you started schooling me on some things, and I was finally able to ask you some questions because I have been struggling by myself and not understanding the process of what was going on. You hear about menopause, you hear about hot flashes, but it was so many other things that were going on with me, and I really thought I was going crazy. I really did. So if there are 50 symptoms and I had at least 48. Yeah. Trust me. I was like, and then when I finally started Googling stuff, I was like, oh, yes, okay, so I feel crazy, but I'm not really crazy because it is going on. So, and then since then, I've had a lot of friends, and I'm on the other side, thank the Lord. For the most part, who are going through the thing, have gone through the thing, and they're struggling. And there are a lot of myths and just misunderstandings. So I wanted to bring you on to talk about the thing, because that day you made me feel so much better. Although the symptoms didn't go away, but at least I had a better understanding and a different approach on how to deal with pre-menopause. So let's start with the definitions. What's the difference between peri, and then menopause?
Okay, so it's all related to the menstrual cycle in general. So pre-menopause is when you're having you're younger, whatever, from age 13 to 40-ish something. Okay. When your cycles are coming pretty regularly, assuming you have a regular cycle. Then post-menopause, I'm going to start to go back there first, is when it's been gone, your period's been gone for a whole year. Yes. No cycle for an entire year. Right, okay. And so that's that side. The funky part is peri.
Funky it is.
The funky part is peri. The funky part is between like 40-something and probably early 50s, depending on the individual. And it's that time when the hormones are kind of like all really wacky. The period has not fully stopped, been gone for a year, but it's not coming normally every month either. You may skip a month, you may have 2 in the same month, you may be a couple weeks late, it might show up. It might not show up, it comes when it wants, it does what it wants. It may cramp more, maybe heavier, maybe lighter. It's all over the place, really depending on the individual.
Gotcha.
And so that's the part where I'm like, what is going on?
Yes.
I have so many consults. I have a period for 3 weeks. What's going on? And then we'll check on their hormones will be all over the place. And so how I have to explain menopause in a real simple way is like hormone withdrawal. Because you've been getting hormones every day since you were a child. and you got your period in your early teens or whatever, and every month you had this nice level of hormones just flowing. And then all of a sudden your body's like, oh, we're not doing that anymore. And hormones start to drop, or they go up and down. And so everything that the hormones were doing, now it's not doing anymore. And your body's like, whoa. What's going on?
This is why I love you. That's exactly what I'm saying. You frame that thing. Yes, that makes sense.
So what's going on? So like you drink coffee every single day, and then you start drinking coffee, you might feel funny. Well, you had these hormones every day for years, and now you don't have it. And your body's like, hold up, what's going on?
Right.
And so all the things you didn't know they were doing, now you're feeling all this stuff because they're not there anymore. And that's kind of the plus and the minus of it. That's the baseline of it. So now you feel funny, your head might hurt, you might have anxiety or depression, or you have a hard time losing weight, or the hot flashes, because it's more than just hot flashes.
Yeah.
It's a bunch of stuff. Mood swings. You mean everybody. You don't have the patience you used to have. Or you're crying all the time, or you're up and down, and you're all over the place.
Did I tell you I had 48 on 50?
Yeah, all over the place. And you're like, what? So all that's happening in that peri phase. And it's like your body's literally like, almost like fighting itself, because your ovaries, which are the lower organs at the bottom, they want to keep going. They keep you get estrogen. Your brain is like, whoa, let's keep going. So your brain is putting out high amounts of this chemical called FSH. And FSH is what makes your ovaries kick on. So imagine if the generator is your brain and the ovaries are your batteries.
Okay.
And your batteries are dying. So your brain's like, more power to the ovaries, but it's not kicking on right. So your FSH is going up. Your estrogen is going down, estradiol's going down.
Gotcha.
And it's like that's the fight of keep going. No, we're not doing it. Keep going. No, we're not doing it. So you're a little bit all over the place when it comes to that part of your life.
That makes
sense, right?
That makes so much sense.
That's it.
Because that's exactly what was happening. Okay. But I like when you said the hormonal withdrawal. I mean, that's just a simple phrase, because literally that is what's happening, but no one said it like that before.
It's just it's like a withdrawal. So now you're like, whoa.
And so the rest of your body's like, okay, but what happened to? Because
what happened to the
autopilot of how it functions.
Right.
Okay.
What happened to the estradiol? Where is it? Wait. That's how we sleep good. That's how we function. That's what keeps. Hold up. What's going on?
Because I was saying to people, I was like, well, I feel like my body's just going in reverse from like when we first started getting our cycles, because then it was like the boobs were tender. I started getting cramps, because I hadn't had cramps since I was, teenage, like all this stuff. And I was like, what is happening right now? And I don't have children, so I thought I was supposed to get a pass, right? Like, okay. But then I'm reading, it's like, no, there are certain things, because I didn't have kids, that it actually, was a little bit. So so now, let's talk about these headaches and the migraines.
Yes.
Because I had never had headaches.
Me either.
I ain't gonna say never, but it was not a thing. Like, okay, I don't, because I don't do over-the-counter medications and that kind of stuff. You go in my bathroom, I don't have it, right? So I went to this job, sitting in front of these big computers every day. I'm thinking that was the issue, because I'm self-employed for the most part. So here I'm doing something new. So for me, it was like, okay, I'm sitting in front of these computers. I went to the eye doctor, got a prescription, all this stuff.
I was there.
Right. I was going through it. And my head felt like somebody had it in a vice every day. And I blamed it on the job. So I left the job. That's the other stuff it makes you make some decisions. Yeah. I still don't regret that one. But what causes the headaches specific? Is this the power that you were talking about?
The energy? It can either be your estradiol or your testosterone, which testosterone is the predominantly male hormone, but women make that too. Okay. And we lose that first. That's the first hormone that tanks. And that tanks kind of like before your periods even get wonky. That tanks like in your early 40s. And so it just goes lower and lower and lower. And that's why like you can't build muscle mass as well. You can't, you gain weight. Your sex drive done in what it used to be. But then also the headaches, because that is from your testosterone decreasing earlier on. So you're like sleeping at night. That's testosterone deficiency, night sweats, all that happens. Like it starts in your early 40s. So you might still be getting a period every month. So you're like, I'm not menopause.
Right.
So good. But your testosterone level might be like really, really low. And that's funny you say headaches because I had the same symptom and it started probably 6 years ago.
Oh, wow.
And I would get the headache, but my headache would come and then the next day or so my cycle will come. And it took me a year to figure it out, the connection. Wow. I mean, I'm like you, I'm going to the doctor, I think it's my blood pressure, making them put me on blood pressure medication. Took one medicine, put me in allergic reaction, sent me to the ER. Almost died.
Dr. Lorie, come on now.
I'm like, it gotta be my blood pressure. And then I'm this headache and I can't. I'm like, and I wasn't a headache person, never was a headache person.
Right.
So I'm thinking, what am I doing? And finally, as a story, I started doing hormone replacement in my office, and I went to this conference, and they're like, we're gonna put give you this hormone, these pellets, and that got rid of my headaches. And I was like, that was it?
What?
All this time, that was it. And I haven't had headaches since, thank God. But it's the hormones as they drop. All the stuff they used to do, they just stopped doing.
That is amazing because, so in the midst of all of that, I pulled my quad tendon. Mm-hmm. Had to have surgery. Mm-hmm. And in the maybe like 3 or 4 weeks after my surgery, the headaches came back. Mm. And they were even more intense that I forgot about my leg. This is just how bad it was because I'm at my ortho and she wanted to talk about my knee. And I'm like, but my head though. And she was like, I can't help you with that, to the point she did something for me. It was so awesome. She did give me a prescription. It was like a 4-part something that she was like, because you look like you're struggling. Because normally, even with me going through my leg, and I was coming in there like, it's going to get better. Not those days. And so she finally gave me a prescription and I learned how to lower the dose. Like I would take half of the pill or whatever when I realized I made it stretch out. Because she told me gave me like 2 days work, but it was so powerful. I was so grateful because it's just like, I guess when they say when your back hurt, like when your brain is hurting, I could not function. I couldn't focus. I couldn't sleep. I couldn't do anything. And so one person was telling me that another PT, not mine, that it was possibly the anesthesia and stuff going through my system, or detoxing or whatever. So that's why I was just totally confused. I didn't know what it was. Was it the hormones, whatever? But then when I went to that job afterwards, it was clearly the hormones. And then you see I don't have my glasses because I cleared that up. Right. Because I could see. Like I had the moringa leaves and my ginseng. Because I'm a holistic. I like doing natural stuff. Right, I'm like, I don't want to wear these glasses because I'm like, I can see. Right. I'm sure I can not see as well as I need to. But I didn't want to wear those things every day. Yeah. And so I got rid of that. So let's talk about, you said you can get tested for your hormones. What does that look like?
A blood test from your doctor. Okay. They have to know what they're ordering. Typically the FSH, as I talked about, that's testable in your blood, your estradiol, your testosterone level, your thyroid level is another thing that really gets wonky in perimenopause. And thyroid, FSH, estradiol, progesterone, and your testosterone. Okay. So those 5 things will tell you a lot about a woman's status. And then symptoms. I think, one of the problems with my medicine is when you send a blood work off to a lab, you get back this range of what normal is. And it could be anywhere literally from 0.5 to 4.3. Right. And if you come in anywhere on that spectrum, you're normal. And then, but I don't feel normal. Right. And a lot of practitioners have to get back to treating the patient, not just what the numbers say. If the patient is saying, if these are the symptoms and they saying they have all these symptoms, well, let's work on these symptoms and see how you feel when we get done treating you and see how that goes. So you get that blood work done and then talk to your provider about what kind of options you have. Now, the sad part is most women will go to their primary doctors, and this is no shade to primary doctors or family practice, but like the vast majority of patients that I see with hormonal issues have already been put on Prozac, Lessapro, Xanax, all the psych meds, antidepressants, because like that late 40s, early 50s, they're going in there and they're like, wow, all over the place. And the first thing the doctor does is you need some psych medicine.
Yes.
You know what I mean? I don't have a Prozac deficiency. I got a hormone deficiency.
I got a hormone, right. But if we don't know to say that, which that's not our job because we're not necessarily doctors. I mean, it is our job because it's our bodies. But at the same time, if you don't know, you don't know. And so, because like as you're talking to me, I know a couple of people specifically. One, she's telling me, I got all these symptoms, I got this stuff, and I keep talking to my doctor, and they keep telling me, no, you good. But if you live with this body, you know that there is something off. And then another friend, like, they were on the Xanax and a whole bunch of other stuff just given to them. And I remember saying, I think you need to take that down a notch.
Yeah.
You need to go revisit it. And it wasn't no shade to them, but you know, I know you as a person, and I know you're off, and I know you have to not be feeling well from the inside out. You know, and then when you think you're going crazy, that's even worse, because then you don't want to be out there with the people, but you still have to function.
Yeah, you
gotta go to work. And then like you said, then the irritability, then you snapping on people. I remember one time my birthday party, my friend was like, why are you being mean to everybody? And I was like, they're not acting right, you know. And I can look back now like, oh my God, because that's so not me to be that. But I remember my sister was going through it, and I used to laugh at her like TV, but then it was like, that really does kick in, and it happens, you know. Because I know also, I've had women making, including myself, major decisions while you're in the midst of this hormonal thing, where they end up like divorcing, or like me, I retire from my career because I just keep figuring stuff out, and I'm like, what?
Yeah, you just gave me such a revelation. I'm telling you, and you're right. My mom, this is probably 30 years ago or so. She was like in the throes of like, and I lived with her for like maybe one summer. Okay. And I was like, I thought she was bananas. I was like in my 20s, I was like, you're bananas. You need to talk to somebody. Like I really said, you need to talk to somebody. But she retired from her job at that point in her life. And now that you said that, I was like, that was all that same summer, that same year. And when I say she was bonkers, like she was like pew, like she would get set off, like funny story. And she would kill Sherry saying this, but she ain't gonna listen. But anyway, look, because I'm over there like I got a story about should I tell her? So no, we were. It was between college, medical school, and my residency. Okay. And it was a summer, and I was staying at her house for like a couple months until I moved, and it was like 10 o'clock at night, 10:30. And I heard slamming cabinets. And I'm like, what is she doing? Right. And she's like, I can't find my makeup brush. It's 10:30 at night. We all got pajamas on. What you even need it for in this moment? I can't. Like, she is going off. She's looking for y'all always moving my stuff and blah, blah. She's going on. My little brother at the time was probably 15. She goes in the room. He ends up getting the beat in. Like, why we not even sure? Like, what is wrong with you? You are way crazy right now. But you know that summer, that time is when she decided she was going to retire from her job, which in retrospect probably wasn't a good thing. No, probably not a good thing. Probably not a good thing. But yeah, that it was all that time, and she was off her gourd, like for at least the months I lived there. Right, I got to get out. You got to go. I got to go. And that's so funny you say that. So yes, I made some major decisions about my career in front of the camera, and I didn't send my agent, I'm done, you know. I mean, I had some justification, but at the same time, I look back like, oh, but that's what I did. And then when I did come back to the industry a few years later, I was actually on the production side doing castings for film and television. And so some of the people I hadn't seen in years, and I realized that was a lot of my support system of people in the business. But if I don't see you and I'm not at auditions and we're not on set, I was like, so then it was that sense of loneliness, like, oh my gosh, I'm going through a thing by myself, so I probably made myself even crazier. Right. And I dated someone, but it's a dude, so he's not really understanding what was going on. And so they would, you know, these girlfriends who I hadn't seen in years or a couple years or whatever, like, where have you been? And I was like, and the ones who were like in my age range, I was like, girl, I've been going through the thing. So I would tell them a little the thing. So I would tell them a little bit about it. And the next thing you know, I swear, an hour later, they're like this. Because now they, for the first time, realize
they're not going crazy. It is a thing.
It's a thing.
They couldn't really explain it to their husband, so they really didn't say anything, whatever. And then I'm telling them certain, what kind of teas and stuff I was drinking, depending on whether it was a hot flash or if it was a night sweat. And there's a difference between the hot flash. So tell us the difference between the hot flash and the night sweat.
Okay, well, typically the hot flash is quick. It's usually just a few seconds.
I feel like
kind of starts in this area, upper butt, neck, chest, head, kind of like just all of a sudden, like your face is just hot. You want to just fan your face to get air. The night sweats is just kind of like your whole body kind of warms up and you just sweat profusely, and it tends to last a little longer than a flash. Now, a flash could also wake you up out of your sleep because all of a sudden, like I said, you do get really hot.
Okay.
But the sweats tend to just, all of a sudden, you just hit this place in the middle of the night where your body's just like profusely sweating.
So what's causing what makes it?
It's like the flash is the decrease in the estradiol goes down.
Okay.
But the night sweats are more from like, so all hormones kind of work on these rhythms, like circadian rhythms.
Oh, okay.
So they kind of go up and down. And so in the middle of the night, they're supposed to all be like nice and balanced. When you're perimenopausal, they're not. So then all of a sudden your internal temperature rises in the middle of the night and you begin to sweat because your thyroid's doing stuff, testosterone's doing stuff, and then you're like, why am I soaking wet?
Hello?
Why am I drenched?
Right.
Which is a little different than a hot flash.
Trust me.
Yeah.
And I try to tell them, like, no, there's a difference because, like, with the hot flash, for me, it was horrible because you're in the middle of someplace and your clothes is just sticking to you. Yeah. And then your brain gets foggy, which we're going to talk about that too. Mm-hmm. Like, I can't function. I can't focus. I'm going to get with you in a minute when this is over. And I remember years ago, ladies who were older than me, they were like, I'll be back. And I didn't understand it. Right. Now I get it. And then they come back and they all like, you have baby wipes and all kinds of stuff with you all day long. And, but then the night sweats, because then for me, I felt like because I'm awake with the hot flashes, I was burned up from the inside out like somebody lit a match on the inside. But then the night sweats, which was still not sexy, but it wasn't as bothersome because I'm asleep and I wake up and everything just wet. Right. And then you flip the pillow. And then you go to the next pillow, and then you have to wash the sheets every night. Like, it was just wet. But
it doesn't wake you up.
It didn't wake it because I didn't feel the heat like you feel the heat with the hot flash. Right. See, the hot flash when you eat. Yeah. Night sweats, you just, like I said, not like I'm sweating. Yeah. And I actually lived with somebody at the time, so it was like, this is not sexy right now. So there is a difference. And those are the kind of things that I was, talking to my girlfriends about over the last couple of years, because they're just like, I can't believe this is happening. And then, they just want acknowledgement like, yes, it is a thing. Happening. And then for me, anxiety. Mm-hmm. I was never an anxiety-ridden person. Right. So that went into overdrive to the point I had to write on my mirror, and I end up using this as advice tips for my girlfriends. It is not you, it's the hormones. Right. And I would just go in there and just read it, because some days I'm just like, why am I overthinking? Right. And I'm just like, having these butterflies, like I had never been that person.
Palpitations.
And all of that.
Panic attack. People never had panic attacks before, can get panic attacks.
All of that. Like, so what triggers that?
It's again the hormone, the decrease in the hormone levels.
But which one?
The progesterone is going to give you anxiety.
Look, I need to know this.
Because that kind of gives you like a sense of calming in general. Okay. So when that begins to drop as well, it's like you feel overwhelmed. You feel like, oh my gosh, what's happening? And that was never there before.
Okay. And that's why I wanted to have you on specifically, to have a conversation and not just doctor to answer these questions, because this is real, because this is how we're talking about it with one another. And I know you understand, not only because you're a doctor, but you're a woman, and then you were talking to me like you were giving me this level of understanding and confirmation that was just so comforting.
Not crazy.
Right, you know what I'm saying? And then even when you do break it down in the medical terms, you make it like, oh, okay, it makes sense. Like you're not just talking over my head or just belittling. Because like when you do go to your primary, for real, when you go to your primary, because I was telling my doctor stuff, and then it's just when I got to that phase, like, oh yeah, that's just what happens. Yeah, okay, but I need you to feel like, can you help me out? Yeah. So then another thing for me, and I'm just gonna keep using me as an example, and then obviously anything else that you can bring up, cholesterol level went up. And so I was getting my regular checkups, and they were like, "Your cholesterol," and I wasn't even necessarily eating any different because I'm a vegetarian, and not to say just because you're a vegetarian is like totally healthy because you can't eat some junk, but I wasn't eating any differently, and I hadn't had a cholesterol issue, and my parents did. So I was like, was that genetics? Was it? So then I read. Okay, a lot of times your cholesterol level does heighten. What causes that?
Again, the hormone. Like the hormones really do like everything. Like it's crazy. Like they do everything, and they play such a role in everything. Like they metabolize everything, skin, thought processes, just so many different roles. And then again, just when it starts to drop, your body starts to react to those things.
Right, okay.
You know, your body's starting to like. That's why women, you know, the number one killer of women is still heart disease.
Right.
Not breast cancer. We want to believe everybody's scared of breast cancer, but the number one killer is heart disease, and that's heart disease when over 50. Why? Because we're postmenopausal, and we don't have the protection that we used to have from all those events when we were younger.
Right. I got you.
The reason that heart disease, you know, skyrockets is because the estrogen and testosterone, they're protecting our heart, protecting our bones, protecting our brains from the Alzheimer's. And as they begin to drop, all those protective forces aren't there anymore.
There should be a class.
The whole class.
I mean, seriously. I mean, we have biology in school, but we really don't learn what we really need to learn to really, you know what I mean? Because even chemistry class really is relevant to everything that we are, but we treat it like just a subject and not who we are, and that we live this every day, unfortunately. Because as I get older, I'm realizing all that stuff is relevant to what we are right now.
It is.
So, okay, so then we had the cholesterol, and then you mentioned thyroid, because I know a lot of women
have suffered with thyroid,
right?
And then so just most Americans, if they eat a regular like American-ish diet, have a lot of issues with thyroid because the thyroid needs iodine so they iodize salt, so you get iodine from shellfish, you get from that. Because America not sucks, but kind of sort of like sucks with nutrition. They put this. Remember, speaking of chemistry, remember that periodic chart?
Yeah.
Iodine, bromine, chlorine. So in America, they said we'll need to put iodine in bread because bromine's cheaper and easier to get. So we'll put bromine in all the baked goods and the baked products instead. Now, if you remember anything about the periodic chart with receptors and chemicals, if a chemical looks similar to another one, it can mimic that chemical and attach to a receptor but not turn it on. So I think it looks like this. Imagine, you know how like you have some keys and they look the same, and you put the key, it'll fit into the lock, but you can't open the door. So that's what happens with all the bromine in our diets, that it attaches to our thyroid, and we're like, okay, but the thyroid is there, but it's not
activated.
It's not activated because of the diet. So people, iodine is a mineral you can get over the counter or at the gyms or whatever. Most people should be taking some iodine because it's gonna affect how our thyroid functions and help elevate our thyroid functioning across the board.
Okay. Yeah, because I know a lot, that was one of the issues as a vegan, not even just a vegetarian, because when I stopped eating fish or if I would stop eating my seafood, which I love carbohydrates, then you're not getting that iodine, and then those are the supplements, which I'm still like always leery about adding, something, other thing that's not naturally produced or whatever. But people are Americans, I'm gonna say that because we got the sugar with the diabetes, and then the high blood pressure. So then they go to the extreme of not getting enough iodine, trying to not
avoid salt.
The salt. So just having that balance and trying to figure out what that balance is. That's unfortunate. So let's talk about the weight gain. That is one of the issues.
That's a big one.
That's a big one. And although women and my friends and my girls are really concerned about their health overall, but that's the one. It's like, at least if I can look good while I'm going through it, I think they would feel better. But I'm like, they get mad at me when I'm trying to tell. I was like, this right here, your stomach, your belly, is there. It's not going nowhere until it wants to go. Because when I'm like, I went from training for marathons and doing my little workout and whatever, and I was still trying to do the same workout with zero results. And my stomach was like, to the point, my oldest goddaughter, I can't stand her. That's the one who wrote that. The one who painted that or drew that. Sarai, she came up to me one day, oh, Aunt Carla, poking me. You've never had one of these. And I was like, I know, but I'm going to need you to leave me alone because I'm kind of self-conscious right now, which is probably another reason why I stopped working. I was tired because nothing that I did, no matter how I tried. So that belly, and then I remember maybe 2 or 3 years after, it was like all of a sudden, because by that time I'm one with it. And I lived with somebody, he was baking goods and, all this stuff. So I'm like, I'm going to eat. I'm going to do all the sugar, whatever. And then all of a sudden, it was like a plug was taken out of me, and it just came out like overnight. I didn't do anything. So that's when I was like, oh my gosh, this hormone thing is serious. So at least I can give them that piece of the story, like, just hold on. It's going to change. Whatever. So what is happening exactly to make it just stay?
Well, it could be two things. One, stress makes you get belly fat.
That definitely.
So stress gets you belly fat.
Okay.
And that comes from your adrenals, because your adrenals, which are little organs sit on top of your kidneys in the back, they definitely, when you're stressed chronically, continuously, every day, your levels go up, and then you do get belly fat because it's storing. It's storing. Now, when you de-stress, you do lose some weight. Instantly. But again, but with the menopause part, you don't you don't build muscle as well, and you don't burn fat as well, which is why everybody's doing this the keto, keto, we're going to burn the fat because we're just going to not eat, all this stuff, burn the fat and kill our kidneys in the process, but it's okay.
That's a whole nother.
That's a whole conversation. But yeah, it's you're not metabolizing as high as you used to.
Oh, that was very evident. And now that you say the stress part, I can see, because anxiety and the stress level was higher than ever in my life. So that does make sense. Okay, yeah. So Lisa, they have that information now, because I'm telling you, that's the one thing. Like, but cause I just blew up, and it was like, whose body is it? I felt like, I did. I felt like I was like possessed or something. And I have a girlfriend, she going through it like right now. Several, but this one in particular. And I'm like, just become one with it. It's going to be all good. So fibroids. I know that's already something that we deal with. And especially, African American women with fibroids. So how and what happens during the menopausal, premenopause, peri?
Well, in the peri, it could be all over the place. Depending on how big the fibroids are and how many you have, your bleeding can get really, really heavy. Depending on, again, how big and how many. Once you ultimately pass over, the fibroids do tend to shrink. They don't necessarily go away, but they do get smaller. Part of the menopausal process is you're decreasing all the blood flow to that area of the body, to the uterus. So when you stop decreasing the blood flow, the fibroids do get smaller, they do shrink, and ultimately, you stop the cycle. But the fibroids don't necessarily go away. They're just
now if you have fibroids and then you go through this thing, can they cause fibroids or
no?
I just want to clarify that.
They're there. If you haven't had them removed and you go through menopause, typically they'll get a little smaller than they were, and they kind of actually get hard, like they calcify. They get really solid and almost like rocky. Like maybe like salt rocks, like that.
And then what do? You have to have surgery to remove them?
And ultimately, fibroids only get removed by surgery. Like completely taken out through surgery.
That's the one I don't have. That's one of the 40, the 50 that I don't have. So
there's a lot of, they do the UFE and all that stuff. You hear it advertised on the radio, and it will make the fibroid smaller, but it does not get rid of the fibroid. Okay. People think that it gets rid of them. It does not get rid of them. It makes them smaller by cutting off the blood supply to them.
Okay.
Or decreasing it, I should say.
So, but surgery, you go in and you can't
take it out. Like it's like a potato.
Yeah, I mean, right. It's so funny. I had a girlfriend years ago. She had like 18 of them, like the size of lemons, and I'm sitting there like trying to picture. Yeah. How is that even possible in your body? And
it's amazing what the body can grow, and like I don't know about men, but a woman's body can grow amazing things and still be alive.
Including people. So
people, like it can grow. I took a cyst out of a lady once, a cyst, and it wasn't cancer, thank God. It was this big around, and it weighed 12 pounds. The cyst weighed 12 pounds.
So she just walking around with this thing. So and it was pushing your organs.
It was pushing, and because it was fluid, it just kept expanding out. And she kept going to her primary doctor. Again, no shade to primaries, but she was getting her paps at her primary doctor and this and that. I kept complaining of just bloating. I don't feel good. My stomach, I'm gassy. I feel full, blah, blah, blah. And the primary doctor sent her to a gastroenterologist with his stomach. So they did this CAT scan, and he was like, get off the table and go to a gynecologist now.
Wow.
And when we got her there, I felt her belly. I could feel
the cyst.
And it was this huge cyst, and it was 12 pounds.
And you performed the surgery?
I did.
Girl, you awesome.
I took it. I'll show you pictures when we're done. I still have the pictures on my phone.
That is so cool. Yeah, oh my gosh. So I'm going down the list. Okay. Bone health, like osteoporosis. Like okay. So now this hormonal shift affects that.
Affect your bone health. Vitamin D.
Okay.
Is most African Americans are deficient. We don't get enough. Vitamin D, but also with vitamin K2 helps it absorb better.
That was my issue.
So D and K2.
Okay.
And then of course you can take your calcium, but those two, the D by itself doesn't do a lot as far as actually getting to the bone, but vitamin D and K2, you may see like an ADK preparation in the health food stores or something, but that D and that K together is what will help you.
So now vitamin D, I know you get from the sun, out in the sun as well. Is that enough?
Usually not.
Okay.
We're not usually out in the sun long enough and have enough body parts exposed. Maybe if you sunbathe a couple of times a year, you butt naked on the roof. Every week, a couple times a week. Okay. But no, usually it's not enough.
Oh, you know what? And with you saying enough body parts exposed to the sun.
Right. The surface area. The skin is like an absorption organ, so you have to have a lot of.
But typically you just this or this or that.
Sure.
Okay, I got you. I like that. And then the K2, what does that do exactly? Like
it helps to solidify the D and lock it into the bone. So you can take D, but it doesn't get to the bone. Then again,
it's just sitting on the surface and it's not activated.
Right.
You're brilliant. I'm loving this boy. I picked a good one, boy. I'm so excited. So let's talk about treatments and options. I know one thing we talked about that day at brunch was hormone replacement therapy. I didn't do it. I didn't do anything beyond our conversation. I really didn't. But you taught me something very important about the myths and misunderstandings about hormones. And for me, it was just like, I don't want that old chemical in my body. Man ain't gonna give me cancer. But you straightened me out. So straighten us out on what hormone replacement therapy, HRT, and how can it help and where is it derived from?
Well, okay, so there's two types.
Okay.
There's synthetic and there's what they call bioidentical. Okay, so that's the first thing.
Okay.
So most people hear hormone and they think the synthetic stuff. Probably 2001, this big study came out about hormones, Prempro, Premarin, and it's going to cause cancer and strokes and all this other stuff. And I was like, oh my God, right. And they stopped taking it, and they were miserable after that because they were like, And so it's not, those were synthetic hormones, two specific types. Premarin, pregnant male urine, was estrogen that was derived from horses. And they put it in pills, and they gave it to people.
Okay.
And Prempro was Premarin with some pro, which is progestin. Okay, so let's kind of break that down. So, like as I just said earlier, it's hormone withdrawal. So your body been making hormones.
Right.
Hormones are not foreign to your body.
Right.
Been making hormones. However, when you look at the back to chemistry class, the chemical structures, remember little squares and lines and stuff. Okay, so estradiol, progesterone have very specific chemical compound structures.
Okay, makes sense.
So the synthetic hormones are progestin, not progesterone, and it's usually it's like ethanol. It's an ethanol estradiol something with extra names thrown in. You know.
Gotcha.
So basically, it's like this is how I explain to all the patients, and every woman gets this.
Okay.
So work with me. So the difference between a bioidentical and synthetic is like if you buy a knockoff purse. Everybody want to knockoff purse, right? Knockoff Louis, Gucci, whatever. And when you first get it, it looks like what you could have bought from the store. You know, you can handle it. After you wear it for a while, the threading's gonna come out. The little peel's gonna start to shred a little bit. It's not gonna look as fresh or as polished as your authentic one. You paid $1,000 for this one.
Right.
You can knock that thing against the wall, run over the car.
Right.
It's gonna look the same and function the same as it always did because it's the authentic one. The knockoff is not going to function the same. So synthetics are your knockoffs. Your bioidenticals are your authentic ones. So that when your body sees your authentic, your natural hormones, it knows what to do with them.
Right.
It's not foreign. It doesn't have extra methyl groups and other stuff, chemical compounds that it doesn't know where to put them.
What to do with that.
So those are the compounds that get put in your breast and cause cancer. Those are the compounds that get put into your plaques because your body's like, I kind of know what this is, but I'm not sure what this other stuff is. So I'm going to throw this stuff somewhere and try to figure out what to do with that later. As opposed to your natural compounds, which are usually plant-derived. Those are ones that your body knows what to do with.
Makes sense.
And that's how I explain it to people. And they go, oh, it's no better. So all the risks and stuff aren't the same. Now, here's the other problem with bioidenticals. The problem is this. With bioidenticals, I can't just give you 5 milligrams of this pill.
Okay.
I have to take your blood, test you, see what your levels are, and then give you a compound that's specific to you.
Gotcha.
So people go, oh, it's not FDA approved. Because the way the FDA works is the FDA says you got to give 100 people 5 milligrams and see what it does. Well, what if that person needs 7? Well, if that person only needs 3? Well, if that person needs 10? I can't test for all of the variations in people with just a one preparation type of a pill.
Gotcha.
Or a pellet or a cream or whatever.
Gotcha.
So that becomes the issue with the bioidenticals versus synthetics. The FDA is like, well, no, because of the way they do what they do. Again, treating a number and not the patient.
We know that.
Yeah,
we do.
So the bioidenticals are plant derived.
Okay.
And so when your body sees them, it says, "Oh yeah, this is estradiol. I know what to do with this," and it does what it's going to do.
And so, what forms does that come in?
It can come in. There are some you can get some pills, the estradiol pills. Bioidenticals. They do come in creams. You can get them like mixed at the compounding pharmacies, specific pharmacies. They also have pellets, which is longer acting. They go underneath the skin. Oh, so those are the
do they have patches?
No, there aren't any bioidentical patches.
Okay.
Not as yet.
Okay.
But there are creams, there are some pills, and then there are the pellets are the main 3.
And that makes so much sense. I mean, I'm not even going through it anymore, but I feel just having the information.
I know.
It's like, because he's like, knowledge is power. And then it just makes me feel so much better. Like, oh, okay, that makes so much sense. But with, like you said, the FDA, unfortunately, they go with the numbers, you know.
Right.
And so it may be, because even if we have some type of prescription that they've given out, and they also now have the lawyers on TV saying, if you took this thing. But for them, it's like, Well, the number of people that are being helped from this outweighs the number of people that are being damaged from it. Right. Which is still like for the people who are being damaged from it, they're
that's
like,
not good
that's
for
not
them
good for me.
Right.
I got you. So now you write a prescription for this based on your testing from the blood test, and then they can just go to the
compound mix. I think we have a conversation what they want to do with it. They want to do a cream. They want to do a pill. They want to do a pellet. You know, we just try to work with the individual and try to see what they.
So, are any of them more effective or long lasting?
The pellets are the longer acting ones, but they're also not covered by insurance. So,
that's
the next thing, not covered by insurance.
So, why is that? Do you know?
It's because
it costs more.
It costs more than probably week by week, probably not, but the pellets work like over a 3 to 4 month range, and then you come get another dose in the 3 to 4 month range over that. So if you hear all at one time, it sounds like it's more money than if you're paying like $100 a month. But if I'm paying $100 a month all at one time, it's like $300 a month. It's like, $300 a month for 3 months or 4 months, but it just depends on like that.
So now, with that being said, so for instance, okay, I did that for 6 months or a year, and then it's like, no, okay, this is not working anymore. So you retest me to come up with a different, to check, so we can
and we
change.
Follow blood work.
Okay.
You want to follow blood work at least every 6 months, if not, annually or every 6 months, just to see where they are, what they're gonna do, because they may, be kind of tapering off and dealing with the symptoms and stuff, but. It's kind of one of those things where you don't know how bad you felt till you feel better, and then you're like, "Wow, I felt like this in 20 years." Like you feel good, and you're like, "Oh, I don't want to feel bad again." So
trust me, like,
and then they come back and do whatever
Because those mood swings and all that stuff, I remember it's just like, who am I?
Yeah.
And then you're affecting the people around you.
What's happening?
And so one thing for me, I know, not necessarily me personally, but just from conversations with my folks and men too, because I have a lot of male
they
friends.
Go through it too.
And they go through it too. So that's going to be part 2 of this one. If that's
they go through it too.
They go through it too. But being in relationship with a woman who is going through it. So when I was with the person I was with at the time, he was really cool about why I was going through the thing. So it wasn't like necessarily for me affecting us necessarily, but I can tell we were out and about, and I was talking to another female or girlfriend, and we were starting this conversation. And I remember seeing that aha moment when he was like, "This is a thing. Right. Like, she not just going, like, yes, you think I signed up for this and I'm just going to wake up and be whatever." And I saw him have that moment of like, and then we got home, he was like, "I am so sorry, you really going." He wasn't apologizing because he wasn't being anything, but it was just like, you're really going through a thing. Like, yes, there's an alien in my body right now, or kind of get out or whatever. And so I had on the other side of that some girlfriends where their husbands or mates who still refuse to believe this is a hormonal thing and they're not in control, and that they're choosing to be irritable or whatever. And so that is making it worse because now I don't have you as a support as my guy. You thinking I'm just over here being some kind of way with extra. And it's like, no, it's just like the guys when you say the testosterone and their sex drive, they like to use that and say, because it's the truth biologically, like, I really can't control it. You can, but you can't, you control the physical, but you can't control the biological side. It's the same way for women. And that was another reason why I wanted to figure out how to shape this conversation, or if we can expand on the conversation to a workshop or something where it's couples. Sure. Because the men need support on how to support their women, and then to know not to take it personal. And then don't give it back to that person who needs your support. So it's this, it's a cyclical thing. I've
had clients come in and I always ask my clients, so who referred you? How'd you hear about it? And they'll be like, Mr. So-and-so. And I'm like, Mr. Like, I'm a gynecologist. At the time I wasn't really seeing men at all. And they're like, I was like, I don't think that, his wife comes here. And whatever you gave his wife, got her straight. So he told me I should come. And I would laugh so hard about that. And it happened a few different times because, even just offering the creams, which is what I was offering, that's one of the things I offer. these women were just having so much symptom relief because they had just been so crazy before and just out here wilding. And I don't know what's going on. You know, Georgia is, you know, probably now more providers and doctors that look like women and look like us. But you know, at one point in time, and even in some small areas, it was a white male predominated field. And so the kind of going thing was, you don't have kids, get a hysterectomy. And they were snatching out these ovaries and snatching out these uterus in these young women. And then the women are bananas for 20 years and think they, you know, their husband done left and the kids hate them, everybody hate them, and then finally they get some hormones and they're like, oh my God.
Because when you have a hysterectomy, you get that all taken out, you're gonna have those
now when you have the uterus, so the uterus is just where the babies are, where the period is. The ovaries are really what control the hormones. So you can get a hysterectomy and just take the uterus out and not really affect the hormones too much. Okay, because the ovaries are still functioning. They're still doing their part until they would have stopped at 50 or 51 or whatever. They'll keep going. Gotcha. But there was a time when people were just taking it all out. See, those are the ones that I know about, like my friends' moms who went through that. Yeah. But because of the time period, I know they took everything out. And that, like, I've literally seen a lady have a hysterectomy on a Thursday, and by Saturday morning when she woke up in the hospital was bananas. Crying, and I was on call from one of my partners. This is back in Pennsylvania, and I walk in the room, and she's just bawling in the bed, and I'm like, "Why are you having pain? Like, what's going on?" And so I was like, let's put a patch on her at least. It wasn't about let's just put a patch on you. You feeling a little bit better, right? Because it's like somebody just ripping out your hormones, just like that. Oh my God! Just like that. This is amazing. And you wake up the next day in full-blown menopause. And your body is like having almost like if you was shooting heroin, they had to detox and jump. Like, you're crazy the next day. So, you know, over the years, they don't necessarily do it like that where they just take everything out and don't give them anything. But there were people who did go through that. And then, you know, then by the time they get to be 45, they can't even have sex anymore because their vagina's so dry. Ooh. And it's so wrinkled and, you know, all of that. That's the other part of menopause. I don't have that one either. Good. That's TMI, but it's still. Yeah, no, but it's a thing. It's a thing. So for the people who have their tubes tied, so is that the same thing in terms of cutting off hormones? No. Okay, so that's not taking. That's not the ovaries. Okay. Yeah. So what are they going through? Because I hear them going through something. The people. What I've heard is that people have like heavier cycles and more cramping with the tubes being tied. Oh, okay. Some people say it's not a problem. Some say it is. But I've heard, different things about it. So, are there any foods or things that we can avoid to keep it from, or keep the symptoms down, low, or minimize? There is a supplement called DIM, D-I-M. D-I-M. Okay. And DIM helps your body use estradiol more efficiently. Okay. So what little bit you do have, it helps convert to estradiol. And it's basically made from like broccoli. It's like, imagine eating like 6 bowls of broccoli. Or like Brussels sprouts. Right. And those cruciferous vegetables, which have a lot of really good stuff in them. Right. But we can't eat enough to get what we need. So DIM is derived from those vegetables. Okay. And it can come in a capsule form. Oh, wow. And that's a great, like if you don't want to do hormones and you don't really want to, do all that, that's a good over-the-counter supplement that you can take to help take the hormones you do have and make them function to the highest of the best of their ability. Okay. Man, that's incredible. So, in terms of physical fitness, is there anything that we could do? I mean, I know in general we all supposed to still be physically fit. Yeah, but are there anything specific that can cardio, help us? Cardio, weight strength training, because cardio releases endorphins and that makes you feel better. So getting your heart beat up,
right,
feel better. So those kind of things, if you can maintain those kind of things, it can lessen the blow, lessen the symptoms.
Yes.
And everybody's different. Some people are going to be like, it wasn't too bad, kind of a mellowed out thing. Some people are going to be like way off the wall. What I've kind of seen in general is that people who've had like bad PMS and bad premenstrual syndrome and stuff like that have a tough menopause or a tough menopause transition. People who haven't really had too bad of periods don't necessarily have that bad. I'm not sure what that's about.
Right.
I've just noticed that with patients.
Yeah, because see, I never had the PMS. I never PMS, and my cycles literally were normal. Excuse me, and never had an abnormal one ever until it just stopped.
Right.
So I didn't even have the spotting and the sort of kind of
was like done.
But I did have it was all of a sudden it was like, okay, it's water. For a couple of months I was like, what is happening right now? And then after that it was just like, but I just can't imagine with the PMS, because I guess I never had that, and then bumping up against all of that could just be highly.
Yeah, I think a lot of women ended up, having those nervous breakdowns you used to hear about back in the day.
That's what I'm saying.
Menopause,
right? Because back in the day they called it being senile, we call it Alzheimer's. It's the same thing. Having a nervous. I remember saying, I am having a nervous breakdown. I remember, literally, I use that I need to go see a therapist. So let's talk about that. What do you suggest, or is that something that you would suggest to possibly go speak to someone if you just need to get some kind of relief?
You can, go speak to someone if again, there's options. You know what I mean? No one's saying you have to be. If you do hormones, lifelong therapy. There's options.
Right.
That you can have. You don't have to just be out here like, wow, I'm going through this by myself. And depending on what your comfort level is with different things, will depend on what it is that you do.
Right.
So if a therapist is going to help, But I would try to avoid the psych meds because it's not really a psych issue.
Not a psych issue.
So I'll be like, before we do psych, again, like I said, when I get people, most of the time they're on 2 or 3 psych meds already, if not more.
And so just trying to even come off of that, let alone then jumping on what the real issue is.
What the real issue is when you taper on them. And I have gotten some people off of psych meds because I was able to say, well, let's replace your hormones and get you situated that way. And then they, it's worked for them. Right. They didn't like how they felt on the psych meds. And then if they feel like they want to come off at some point, they can. If they want to stay on, they can. It just depends. But there's definitely options.
Is there support groups for stuff like this?
I don't know. It'd be a good idea.
I might need to start because it really is a thing because we hear our moms and our grandmothers went through it, but they didn't talk about it because they didn't understand it, and then they just accept that these are symptoms and you keep it moving. But now that we are more informed about things and have a different understanding, because for me, I know I need to understand stuff, and then even if it's not changing, at least I can work through it better. And I think I know that's what I get from having these conversations with other women going through it, because I try to warn them, I was like, so this gonna happen, and then you're gonna have a half flash, and then you're gonna get, and so now that some of them are just now getting, and then no, they're not. They like, girl, and I'm going, and I was like, remember when I said that? And they were like, because if you're not experiencing, you're not really registering that information, and now it's hitting them like, oh, you did. I'm like, I know. I was trying to give you a heads up because no one gave me a heads up. You know what I mean? Right, that it's gonna happen.
Yeah.
And so that's why I'm like, we need support groups.
Menopause support. And then with my headaches, once I knew what the headache was from, I didn't worry about it every single month. Because for like a year, I was like, I'm about to stroke out. Yes. Something is wrong with me.
And then the foggy brain.
Yeah.
Let's talk about that. That was another reason why I was on that job that last time, because it was like, okay, is my brain foggy because I can't see because my eyes? But it was just like, okay, I know I had a list of stuff I'm going to do today. Yeah. None of this get done. Yeah. And my girlfriend, another one, she's going through that now, and she's like a supervisor. And just like it was like, people said, remember I told you? She was like, no, I don't remember. Because like a lot of stuff was just so I'm like, you better email me, text me, write it down, or don't count on me remembering it. Because you get into this fog and then like, So when I was dating someone, we were living together at the time, and I'll get up and go in the other room, and I'll get in there like,
what I come here for?
What I come here for? And he was like, what is happening? That's what I'm saying. So he started seeing it, and I'm just sitting there like, oh my gosh. Now it's gone, and that's why I like talking about it. I'm glad I did wait to talk about it versus while I was still in it. Right. So now I can say there is another side to it. Because now I can see it like TV. Like I literally my brain would be like, is it on?
Yeah.
And my girlfriend's going through it now, and she just feels bad when she gets home from work, and she feels like she hasn't accomplished anything. Or she feels like she's not being the best supervisor because
she can't follow.
And it's not a lack of intelligence. It's just that you're going through this thing. Right. Like it is.
And some people last longer than you do. So I mean, I'm not trying to, some people last, it plays out longer.
My sister was 10 years.
Right. So it depending on how far it's gonna take you, because a lot of women, you said yours just kind of stopped. They're up. I mean, they're up and down, back and forth for 3, 4, 5 years, where they get a cycle, then they get 1 3 months later. Right. Then they're going for 6 months. Then they'll show up again. Then they'll go down again. So it can take a while to reach that 1 year of nothing. But so everybody's processing differently. Right. And you just have to figure out how to get through that. That transition.
Yeah. You just got to trust the process. That's the other thing. You got to trust that it is a process once you realize it is a process.
Yeah, and seek help if you need it. Like, don't just be. I have patients who come to see me, and some of them are on hormones, and she was like, I tell my coworkers, go on over there and see her, because she feels like she really couldn't function well until we got her levels back up to where she was like, okay, this feels like me.
And that's why I want to because I want to normalize the thing that feels abnormal. Yeah. You know what I mean? Because then, a lot of women are not talking about it. They're keeping it a secret. Or because they don't understand it, they can't really articulate it. You know what I mean? They're not making the connection to menopause or perimenopause.
And people don't like to hear that word either.
And then they feel like because they don't be like, what? It's like, no, it's what it is. Because trust me, when you get to the other side, you're gonna be like, oh, I should have did this a long time ago. Because I shut that thing down. And I'm like, boom, okay, I see what you're saying.
People come to me all the time.
I'm being really honest now.
And they'll be like, oh, my period is later, this and that. And I'm like, well, how old are you? They're like 49. I'm like, oh, it's okay. They're like, what? Perimenopause? Yeah, you're 49. This is the time. This is the age range.
And see, for me, I had no kids, so I was like,
sometimes it's later. Sometimes it's, if you smoke, it might be earlier. Right. If you don't smoke, it might be later. And they're like, I'm like, yes, you're perimenopausal. That's what it is. And they're like,
so alcohol, smoking, those kind of things can make,
especially smoking. Smoking can make your menopause come sooner. Like some people are going to have, like I say, 40 something, might have it like early 40s or mid 40s instead of later 40s. Okay. So smoking can definitely do that, because smoking is damaging. It kills healthy cells, and free radicals and all that stuff. So it does shut the ovaries down a lot sooner than they would otherwise. Oh, wow. As far as the symptoms, like hot flashes, chocolate, sweets, sugar will make your symptoms worse if you're eating a lot of sugar, because that's just, the body's burning differently and metabolizing differently. And so
what about caffeine?
A lot of caffeine, but not.
You don't have to just cut it out, but
not like all day long.
Right. Okay.
Yeah, no. And then get your exercise, your activity, and that's kind of what I think also that's why all this like self-care, self-love is like everywhere, because you gotta take your time and like pull back and just have your moment and have your me time and de-stress a little bit.
Trust me, I told you. Look, Elevate the Good come from something. They come from a lot of stuff, but a lot coming from the other side of that, and realizing if nothing else came from that, the lack of self-love and self-care as much as I thought I was, because I'm going on vacation. But it's like, no, when you're not intentional and cognizant and really like focus on self-care and self-love. So that kind of was like elevate the good in yourself, Carla. And I just realized it really unlocked some other things for me to pay attention to. Yeah. You know what I mean? And not just paying your bills and not just, like I said, just doing the fun stuff, but really loving yourself from the inside out, physically, mentally, spiritually, emotionally, all those things. You know what I mean? And this stuff would trigger it. Oh, and either you're going to pay attention to it and do something about it, or you just going to think it's a medical condition and keep it moving. And I think that's what our parents, our moms, our grandmothers did. It was just a medical condition, and they went on, and didn't really talk about it with us.
And they just dealt with it. They just sucked it up and dealt with it. Right. And then I was so sorry about my mom. I've heard women say, but my mother was, I got like 18 or 17. My mom was just, she was mean. She turned to this mean old lady, and she was this and she was that. And I was like, she was menopausal. Right. And she didn't know or have the tools to handle any of it.
I've been here for 31 years. And I remember I moved back to my mom's house for a few months, because I knew I wanted to be in Atlanta. My mom saved some money or whatever, because when I was 19. So, but then it was like, them few months, I was like, she's crazy for Cocoa Puffs. And at the time, I just made it a thing. So I was like, I've been here since. I packed up my car like a runaway slave. And I don't know what that is. And then it was when I went through my thing, and then this conversation, just when you're talking about your mother, and now you're saying what you're saying about when you're 18, 19, because I was, I'm like, oh, yeah. Because it seemed like it was so extreme.
It was.
It
was extreme. No, it was. Like, it really was. Because I just think about the people in my life, women in my life, my aunts, they were just mean. Like,
I judged my mother so harshly. Yeah. I can say that from that moment.
Like, the stuff that would set them off, like, the reaction was definitely not in line with the action. Like, you don't have to do all that about this.
You being too much. You know what I mean? Because there were things my mother was doing. I was like,
what are you doing?
Where is this coming from? I just walked in the door. Like, you know what I mean?
Yeah. You come in the door, she throws my
and just having this conversation, even 31 years later, you making me feel like this is a therapy session for me, just like, okay. You know what I mean? You saw what you saw, and it was what it was. But I did judge too. I did
because you didn't know, and I didn't know. I took
it personal.
I had just got out of med school,
right.
And I was like, and I remember this. I said, Mom, do you? I'm trying to get my med school on. I'm like, you should go talk to somebody, like at your job, have some kind of like peer, some kind of counselor or something. Because the stuff she was doing was bananas. I'm fine. I'm just so, and then she would just go off, and I was like, all right, just forget I said anything. I just walked in the room, and then my siblings were teenagers at the time, so of course they're just dumb and just being teenagers, teenager stuff, and she would she would light up the night because of stuff they would do. I mean, or just busting the tears. Right. I saw her cry once over chicken salad, like real tears over chicken salad.
You like
chicken salad? So I was
that's what we doing.
Chicken salad. And I said, you can't you can't make no more. You need money for chicken. Like, I'm trying to figure out what I can do to help because. It was I can see it like TV now. Like it was that intense. It makes and I think I'm glad we're having this conversation out loud, right? Because I know other people have experienced it, although it may have come and gone, but at least now they can make sense to them, right? Because it affects relationships in a big way. Like I said, I know divorce. I judged my mom, all kind of stuff. Like, and again, I took it personal, like. Why are you doing that to me? Not knowing, you know what I mean? Right. And having this conversation can really highlight and or elevate other people's awareness of what they are experiencing, and hopefully get them to seek help. That too. Like if you're struggling with it, you got if you relating, right? If you're struggling, find a provider, seek help. Drive if you have to. I always tell Black women especially, Spend as much time looking for your doctor as you were looking for your hairdresser.
No, you didn't say that.
That's I did say that out loud. Spend as much time and put as much effort into doing that. Because we drive across town, wait 3 hours, pay whatever they ask.
You going in.
To get our hair done.
Okay. You saying it lovingly. I love it.
That's what I'm saying. But
That's
you know, you have in the office mad about your copay, like it's $30.
You got to do what you got to do.
You know,
right.
So
absolutely.
you got to, and you know, and because they're doctors, we're not trying to kill y'all. I want to help you. There's doctors who want to help and have the tools, but you gotta like reach out and find out and find the tools and just. Find and keep going till you find someone that can help you get what you need.
Right. Don't settle.
Yeah, if doctor number one just wants to give you Prozac or Lexapro, okay, I'm gonna go over here.
Appreciate
what's going on.
Yeah, exactly. Yeah, and that's the biggest thing, take away. It's like it's hormonal. It's hormonal.
It's hormonal. It's
not psychological. You may feel crazy, but it is hormonal.
It is hormonal.
And so you got to go at it a different way.
Different approach.
So. Oh my God, okay, let me see what else. Hold on. I just want to make sure I got everything on my list, girl, because I was like, this is going to be, so this was one little fact. It says, women with the greatest frequency of hot flashes reported the most significant depressive symptoms. Other women at a higher risk for depression includes those who haven't given birth and who have taken antidepressant medication. So kind of going back to what you're saying.
Exactly.
And like I said, I thought I had passed because I didn't have kids, but it was like, no, you got ovaries, honey.
Yeah, they still working and they was ready. They was like, and they haven't had any breaks. Like I think when you haven't, like pregnancy is like an ovarian break and breastfeeding is like a break. So that whole time you're pregnant, you're not ovulating and you're not making eggs. And the whole time you're breastfeeding, you're not really making eggs. So you might have a little, when you haven't had that, they're still like, come on.
So then it seemed like it's a dramatic.
It's a much more of a dramatic job. And you haven't experienced that before, because of the no breaks.
You over here doing some stuff. I am very serious. You know what I'm saying? This is just, okay. So then they said some things that contributes, like if you're skipping meals and not enough sleep or too much sleep. And, what about cravings? And like, is that a thing? Not particularly. Okay, because I know someone was telling me, I've been craving. I was just like, let me just ask and make sure. Okay. So now, your facility, just for you, Women's Health.
Yes.
And you are a mompreneur. Let me put that out there.
Girl.
So you have two
children. Yeah, one adult child who still lives in my house. And one teen.
Oh my God, how do you do it? How are you balancing all? Because you birthing babies and all kinds of good stuff.
It's a little crazy. Yeah, but you gotta rely on your village. I don't clean my house.
Oh, okay.
I hire somebody.
Boom, there you go.
And, certain things if you can do it, don't stress about that stuff.
Okay.
You gotta get the help you need. I've been balancing. I've been in practice here in Georgia for 10 years.
Wow.
I came in 2009.
From where?
From Pennsylvania.
Okay.
So I'm originally from New Jersey.
Awesome.
So I've been here for 10 years. So
we're
trying to, always trying to do new things. I've always been, I believe that God gave the body everything it kind of needs to do what it has to do. We just mess it up.
Yes.
We tear it up along the way. So I'm not a big medicine. I don't classify myself as holistic because I do surgery.
Right.
And I can cut people open and take stuff out and fix it. I can do that. I don't mind. I kind of like doing that. But
not only just babies, but I take stuff out.
Uterus out, fibroids out, take stuff out. So I'm not a holistic doctor in that sense.
Right.
But I do. I've been A4M is a American Academy of Anti-Aging Medicine, which when you go there, you hear about all the hormones and all the thyroid stuff and all the newest, more holistic approaches and the supplements and the vitamins and all that stuff. So I'm really kind of into all that.
Okay.
And I do have a lot of that in my teaching with the patients and stuff like that.
Good.
Now there's some who just want a pill, fix it, give me a pill. But a lot of patients are like, no, listen to me. And I try to listen to what they're
talking about. I think
it's
changing, though. People are starting to realize, we need to work with the process that was given us. And trust
I mean, you didn't gain 75 pounds in 6 months. So the odds you losing 75 pounds in 6 months is probably not
man, you're gonna be disappointed.
We're disappointed.
So now, do you have special services or that you offer for teens?
I do. We do teen, like early counseling, STD prevention. Our girls out here wilding. They
that is awesome.
They having sex and getting STDs, sometimes more than one.
Ooh.
So we bring them and we do like a pre-counseling, like a pre-sex counseling. Hopefully they come in before they're having sex.
Right.
Most times, by the time I see them, they've already done it.
Okay.
We're trying to test them and make sure that they're doing okay.
Wow, that is an awesome service. Because I mean, now that I don't want to just put on social media and TV, but at the same time, we come from a time. If you were doing it, you weren't gonna let people know you were doing it, and everybody wasn't just doing it. And now it's like middle school, whatever. They're doing it like adults.
They're doing things.
So we're telling them not to do it, but then everything they see is also telling them to do it. And and so they have these secret groups and all kind of stuff that we are just so not privy to.
Right.
But they are doing it like adults. And we had sex education class, which was really not the most helpful education, and now a lot of times they're not even offering those in school anymore.
Wow.
Yeah, a lot of they're not. And so but it would still be like on a parent who could step up and say, "This is what I want to offer you. Let's go to this doctor to do this thing and have this conversation."
And then the parents are emotional usually. Like usually when parents. I can always tell the energy when I walk in the room with a younger patient because usually the mom is in the corner like this. And then patients on her, they were like, "Oh my God, I'm hearing that."
Right, see, there's that.
And I'm like, "Okay, listen, what's going on?" And I caught her. She got a secret. Well, I had a patient that happened. The young lady had a secret Instagram page that was provocative, and she was posting all the stuff on Instagram page. And mom found the page, and mom, why you? And the baby, she wasn't having sex. But her Instagram page was kind of giving a picture of otherwise. So the mom was like, "I don't know, birth control." So, I get that energy quite a bit.
Gotcha.
I had a client just last week who's 16. She's a boyfriend who's 15, who's already been quite sexually active.
Okay.
But he told her he'll wait for her. So I'm like, well, good. Because he's 15, he's doing too much.
Right.
I told him I said he's doing too much.
Right. Dr. Lorie said.
So I said he's doing too much, he need to stop. And she just looked at me. I'm like, no, I'm serious. And that's just how I talk to them.
Right.
Because they're like, "Oh my God, I can't believe you said that." I'm like, well, this is where we are. You're here for a reason.
Exactly.
So I have all of that. So I have people who are from 14 to 86 and everything in between.
But you're doing it though.
Yeah.
And your approach is so warm and so personable and genuine. That's the thing, And when you make things just real, you say, these kids out here wilding out. That's exactly what we do. You know what I mean? But I like your language. I like the way I'm telling you that day, I forgot we was at the birthday brunch and I'm over here like this. And it just made me feel so much better. And that's why I wanted to do this, to just give, first of all, just obviously medical information, but to give them a sense of solace and just like, okay, you are in control of what happens from here on, as long as you have some information, and then there are options. So just for you, Women's Healthcare, 3976 Highway 42 South. That's in Locust Grove, Georgia.
Henry County.
Phone number is 678-814-4700. And what's the website? Is it just?
It's just for you, OBGYN.com.
Okay, so I'm going to put that on the Elevate the Good page, and I'll put it at the end of the video and all that stuff. I'll make sure they know how to get in touch with you. So let me ask you something.
Yes.
What is your why? Why did you become an OB/GYN? Why do you do what you do?
Wow. I don't know. I've always wanted to do it. Like really, you ask a little kid when they're 5, maybe when you go, I want to be a doctor. I think I came to Earth to do it, to help women, to educate women, to serve women. I think that's what I came to Earth to do. I remember being a little kid, like maybe 5, 6, and I had this book about where babies come from, and I remember being fascinated with the section that talked about how the baby grows in mom's tummy. And I was little, and I remember being like, wow, and I remember that awkward look when I would tell say to adults, girls have a vagina and boys have a penis. And this is in the 70s.
Right.
And then it'd be like, you. But I was so like, this is, that's what it's called.
Wow.
And I remember looking at that part of the anatomy. It was like a cartoon illustrated book of the body.
Okay.
And I loved that daggone book. I would read that thing like it was it. So I think I just came here to do that. And part of my gifting is in just helping women and serving them. And the baby part, that's the part I like.
That is right. The baby's coming out. It is amazing. That is amazing. Because I don't have babies, but I have a bunch of godchildren.
Yeah.
And in one family by themselves, it was 6 of them, and she did the whole natural birth, whatever. And the last 4 were at home, and I was at every birth.
Wow.
Right. So, to see, like, I saw their face before their mama saw their face kind of thing.
Yeah.
And it does change.
Yeah.
I wasn't even pushing babies out, but I would be walking around for weeks just glowing, just that experience, and to see the siblings watch their siblings being born.
Wow.
Like, you know what I mean? Because the doulas and the midwives, they come in
to
prior to, they give them lessons in those books and kind of, so they're preparing for that. And it's just a beautiful experience. I didn't do it. I never really wanted to do it, but I do appreciate it and love and respect. Like, I can cook some babies up in here. A human being can come out. Like, that is amazing. Incredible.
And I think that's something like I came to Earth to do it because I feel like I work with the Creator to bring that out. Like, that part of what I do. Like, I've been the first person to touch thousands of children. Like, I've touched thousands of children, literally, over the past 20 years. First. And my hands were the first ones. So that's just like, there's something, I know I'm not God, and I know He's ultimately in control, but just to be a part of that process, I think is so amazing.
I mean, you just gave me like chills in terms of when you were like, I was sent to Earth to do this. The Creator sent me here to assist Him in the physical and bring in this life. And that is just, and we all have that. Yeah. You tapped into yours early. Yeah. We just don't know. Some of us,
you're right.
Because then when we get older, that's why Elevate the Good. Go within so we can dig that thing out. Now, we might have a lot of junk that's over, but it's in there. Because I wish what your thing is, when you knew you were 5, I wish I knew what my thing had been so I can be, because I done done millions of things. I'm not unhappy about it. But you knew what you knew, and you're doing what you knew, and you are passionate about it.
And I'm just super fortunate. My grandmother raised me, and she just, when I would say that, now, the reason I say that now is I look back because I didn't know any women doctors. I didn't know any black doctors.
Good point.
I didn't know any black doctors till I was like, probably in college. Oh, wow. Where I grew up in New Jersey, I went to an older white man that wore that big metal thing on his head. Oh my gosh! My whole life, I never saw it never occurred to me that I couldn't, or that I wasn't supposed to. And my grandma, God bless her, she was always just like, she gonna be a doctor. She gonna be a doctor. And so she would always speak, and I would just didn't have a reason to not think I couldn't be. And so, but when I look back, I'm like, wow, I didn't know any black. I never saw a black doctor ever. So I got to college, and I think I saw one woman doctor ever. Wow. But every doctor, dentist, whatever, I have a white man. Right. And so just to have that kind of, and I remember being in high school and they showed you that video about when babies are being born. And everybody in my class is asleep, and I'm like, this.
You don't want
I'm like, that is so cool. I'm doing that. I'm doing that.
See, that's okay. You get me all excited, like,
I'm doing that.
That is so cool.
I put it in my high school yearbook.
That's what I'm talking about.
It's in my high school yearbook.
Really?
It is. Yep.
That is so cool, Lorie.
I
love that.
Just, I think looking back at all those things, I think that's just what I came here to do.
Girl, I'm gonna figure out what I'm gonna be when I grow up. When you leave here, look, when you leave girl. But no, that makes me so excited because, again, I just want people to be elevated to the point above their circumstances and their stuff to remember, because it's in our cells, it's in our being, to remember, like, what did we come to do? And it's never too late.
It's never too late.
It's never too late. Just do it. You know, you can all, exactly. Just do it. And it's so because I grew up in St. Louis, and all of the black children went to the same black doctor, because there was Dr. Helen Nash.
Oh, okay.
Everybody, all of us went to this. So people I met here in Atlanta who grew up, like, we didn't know each other, but we all went to Dr. Nash, Helen Nash. She pierced my ear, like,
all of that.
And everybody could see her office, like you described the toys. I mean, like, even as an adult, like, we remember that.
Yeah,
and then her kids took over, and, you know, so they're doctors too. Isn't that cool?
That's awesome.
Yeah, and that's so funny that you say that, because that's my only experience. So it wasn't until I became an adult that I realized, oh, that was a rarity to have an African American doctor, let alone a female. Yeah. Because my dentist was a white guy. Yeah. But and I'm like, how blessed I was, because she tapped into us. Yeah. You know, I mean.
Yeah, that's awesome.
And she didn't treat us as like a number. Like, I mean, because the parents, you could see, they loved her. Yeah. Oh, yeah. The parents loved her, too.
That's awesome.
I know, isn't that cool?
That is.
Thank you, Lorie, for finding your passion. Thank you for sharing. Thank you for always just being so forthright and just real. Okay. That's the biggest thing, you know, being real, because people want to feel comfortable, and they want to know, and they can trust you. So make sure you go see Lorie. Dr. Lorie, she gonna hook you up. Just for you, women's health care. We're gonna put all the information on Elevate the Good. Are you on Instagram with this, or?
We actually, the Instagram page for Just For You just got put up yesterday, but I'm Dr. Lorie J on Instagram.
Okay, Dr. Lorie J on Instagram. Okay.
Find me, put my name in, and it'll pop up.
Okay, good. Please do. Thank you so much. We may have to do something else, because I have a feeling they're going to have some questions. Because I know last year, you did a Living Your Best Life?
Yeah, we did a conference.
Tell me about that before we wrap up. Yes.
Oh, girl.
Because see, that's why I love you. You're like every woman. Like,
you can't leave me alone with my thoughts for that long. I was on a plane by myself going to Las Vegas. And I have this thing. I just think, like you said, people living their passion. I feel like so many people like play small. They downplay it because I'm black, I'm woman, I'm light, I'm dark, blah, 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 blah. You know, but we only get one time around this circle, one time around this globe, and just do it. Like, don't let fear and what people say about you or what they've said to you or your own. It's never too late. Right. Just do it. So Live Your Best Life was just like based on that, and I've just been super blessed to meet some really cool women since I've been in Atlanta. Like, this cool, right? And the kind of people that I could pick up and be like, "Hey, girl, I'm doing this conference. Can you come?" And like literally, that's how it happened. And I had B Dixon. B is I don't know if you've heard of the Honey Pot Feminine Wine. Yeah. So B created the Honey Pot. I met B probably 5 years ago, and that's just like my boo. Like, I love B. And I was like, "Hey, girl, what you doing such a day?" She's like, "I'm Dr. Lorie," you know, so she did it. And Rebecca Pope is another lady who I met through here in Georgia. I had Shanita Foster, who's a philanthropist, and she was on Football Wives, and she's in Africa right now, as a matter of fact. Really? Yeah, and I met her through some networks, and I helped her with some of her kids in Africa, her orphanage and stuff. And so I was like, "Hey, girl, what you doing this day?" And everybody was like, "I'm there." And it was just that simple. So I went to my staff and I said, "Hey, I want to do a conference." And they was like, "When?" I said, "September." And they were like, "This September?" I was like, "Yeah, we can do it." And they were like, "You're bugging." But we did it. We pulled it off. It was great. People came out, so it's gonna come back. We're not done with it. Okay. It's gonna be back.
And so, what was the premise of it? What?
Just living like your best life. So we did business, relationships, balance, and what was the other one we did? Coming back from the ashes. I had Siobhan. Well, Funches her Wade. Okay. Is one of our speakers, who's D Wade's ex. Right. Met her kind of
coming back from the ashes, yes. Okay.
And she had public, a lot of stuff went on with her, and how she's trying to like rebuild. Yes. Her life, from being on public display. Right. So she was one of my guests as well. So these are some awesome people. So we're looking at doing it again next year. So we'll see. Well, yeah, but we're gonna bring it back.
Always.
Because it was super great, and people got blessed, and they're like, "Oh, it's so cool." But yeah, so that's my thing. Like, I want people to enjoy life, live life. Like, you just do what you do. Just I went to med school as a single parent. My daughter was 2 when I started medical school.
Wow.
So I drugged her to all the classes. I was like, "Come on, girl." Yeah,
see,
so
that's what I'm talking about.
Yeah, I had my daughter between college and medical school, and then started medical school when she was 2, and
nothing stopped.
That's
it. Just did it. Yeah.
It was crazy 4 years, but I did it.
But you did.
Yeah,
right,
and the thing is, it's doable.
Right.
We all been through stuff. We all have a story. But you just gotta keep persevering, and you can get to the other side.
And that's the thing, like elevating the good within yourself, so you can have, you're still gonna go through your thing, pre, during, and post challenges, but just keep doing.
Keep going. That's it.
And because you do mission work as well too, right?
I have done mission work. Yep, I've been to Africa a few times, doing missions and stuff. So yeah, I do a little bit of everything.
Elevate the good. That's what you do. Yeah, I love it. Well, thank you once again. I'll make sure they know how to get in touch with you. And thank you for the information.
And let me know when you're airing it now.
So it's gonna be next Monday, which is the 21st.
Fantastic.
So I will make sure everybody knows, and they'll be ready to see your beautiful face. Thank you, Lorie.
Yes,
I appreciate you.
I appreciate you asking me to come here.
Next time, part 2.
Part 2.
Yeah, because I know I'm going to get questions and comments, and they're going to be like, because I actually may ask them to send us some questions and comments, so we can do that. Or we may have a workshop.
Oh, we can do that too.
Okay.
We can do that.
All right. Good looking out.
Thank you.
We've come to the end of a good time. Thanks for tuning in, and I hope you're feeling elevated. Make sure to hit the thumbs up, leave a comment, and subscribe to this channel, and ring that bell below for episode notifications. Until next time, remember to elevate the good, elevate the good, elevate the good, elevate the good. Bye!